Hello everyone, so we chose to do our presentation on the evolution of military nursing by McKenna Black and Shannon McGovern. We're going to start off with some history about military nursing. So over 22,000 professionally trained female nurses were recruited by the American Red Cross to serve in the U.S. Army between 1917 and 1919 for the First World War. And during this time, untrained women volunteers were immediately given the nursing role since they needed so much help. And so limited instructors meant training for the volunteer nurses consisted of one first aid course and one nursing course. So many of these women did not have much experience with healthcare practices at all. So you can kind of see how some tension could rise among military nurses. During this time, at the start of World War I, the nursing profession was transforming from what was called an informally done vocation to a profession requiring schooling and training. Trained nurses working for the Red Cross saw the large numbers of untrained volunteers as a threat to nursing standards, and a debate was started between nursing associations in the U.S. because of this increasing tension.
For current nursing practice, military nurses are considered part of the armed forces, and there are many different branches that they can serve for, and they care for the service members and their families. They mainly care for patients in military clinics, hospitals, or trauma centers, but they can be deployed to combat zones or humanitarian missions. To become a military nurse, the steps can vary branch by branch, but overall, first you have to earn your BSN and pass the NCLEX, and then you can either gain work experience before joining the military or join straight away as a new grad. Keep in mind it takes about 1 year from time of application to get accepted. Once you are accepted, you complete basic officer leaders courses to become a commissioned officer and go through classes and field work, which can take anywhere from 5 to 12 weeks before you're considered a commissioned officer. Some important things to note are that ADN degrees are not allowed. It must be a BSN degree. Military nurse certifications are not required, but they're definitely recommended. The military also hires APRNs, and there's a list of the areas that they recruit from the most. The best way to find a job in the military is to speak with the recruiter for the branch that you're interested in, and it's also important to know that military nurses are not required to go through boot camp. Current compensation for a military nurse is dependent on the rank and the years of service for each nurse, but overall it varies between $58,000 and $92,000. But some other important aspects to consider are the fact that military offers tuition reimbursement, living stipends, potential hazard pay, benefits packages, sign-on bonuses, and even more. So it's important to remember that when looking at the overall salary.
Now we're going to bring it back to the book called The Facemaker. The Facemaker touches on the role that nurses played during wartime. And here we have a quote that we thought was a good depiction of what nurses went through back then. Romantic notions of nursing were soon shattered by the grim reality of bedpans, vomit, and blood. Young women who had never even seen a man in his underclothes were suddenly expected to work with the mutilated bodies of soldiers evacuated straight from the trenches. So women went into war without a single nursing skill or certification in previous wars, whereas today this would no longer be acceptable. And lastly, here we have our sources.